Decode Your Health, Chinese Tongue Diagnosis by Dr. Daisy. What is happening with these two tongue images? Let us analyze this case with Eastern and Western medicine in a minute. Chinese medicine has four main diagnostic methods. They are inspection, listening, inquiry, and palpation. Tongue diagnosis is an important part of Chinese medicine. It is an indispensable part of the inspection of the four diagnostic tools in Chinese medicine. Tongue inspection has been used at the beginning of every visit to observe initial conditions, follow up on the progress of illness and the results of treatment. Each part of the tongue hosts a vital organ of our body. A practitioner will observe the changes in colors, coating, shape and size, marks, moisture, movements, and sublingual vein status of the tongue. What does a healthy tongue look like? A healthy tongue is typically pinkish-red with a fresh meat color, smooth on the surface with a slightly glossy appearance. It should also have a symmetrical shape, fitting the mouth's width. The tip is in the middle of the mouth and free of cracks, sores, swelling, or indentations. A healthy tongue is primarily covered by a thin white coat, which is semi-transparent. The taste buds should be evenly distributed across the tongue and not excessively enlarged. Why does a TCM practitioner check your tongue? The color of an unhealthy tongue body can be red or scarlet red or dark red, pale, purplish, or bluish. The color of the tongue reveals circulation status and degrees of inflammation or infection of the body. For example, pale is a sign of anemia that could be low iron or low red blood cells. A bluish color reveals a low oxygen level in the blood. The color of the unhealthy tongue coating could be white or thick white, yellow, or thick yellow, brownish, or grayish black with a wet, dry, greasy, cottage cheese-like mixture. For example, a brownish-black thick coat can be seen in a severe fever case. A grayish-black wet coat is often related to urinary or kidney conditions. The thickness of the coating indicates poor digestion, constipation, yeast overgrowth, microbial imbalance, or infection, etc. Let us review two more cases today. Case 6. This was a 73-year-old female who came in January 2024 for osteoarthritis-induced knee and toe pain. Meanwhile, she mentioned that she had a history of lymphoma and right-sided breast cancer, but these conditions were stable. Therefore, she was not undergoing any cancer therapies. In this initial visit, her tongue was unremarkable, which is indicated by normal color, shape, and coating. A month later, the lady had 3 vaccine injections for her upcoming African trip and had 3 more appointments for pain management and immune support before her trip. In July, she returned from her trip and anxiously told me that her cancer had spread to her liver. Additionally, she may have pancreatic cancer. She was having mild discomfort in the right upper quadrant of her abdomen with mild abdominal bloating. Her stools were normal with a fine appetite. This time, I took the first photo of her tongue. The color of her tongue was dim, a mixed color of pale and purple, with a deep fissure at the center, mild swelling on the left, and tooth marks on the middle rim on the right side. This tongue image shows her body qi flow and blood circulation were not optimal. The purplish color reveals blood flow slowing down in her body based on Chinese tongue diagnosis. 2 weeks later, she began chemotherapy. 4 weeks later, this lady started to complain of extreme tiredness, nausea, and constipation. She also had tenderness when pressure was applied to the entire abdomen. Her final diagnoses were primary pancreatic cancer and metastasized liver cancer. She was stressed about her new condition. Her chemotherapy did not stop the progression of cancer development. In April 2025, I took the second photo of her tongue, which showed progression of the liver metastasis as the entire left side of the middle tongue was swollen, which is the liver position. There is a red spot in the breast or lung location on her tongue. Her MRI report of the abdomen reveals, in October 2024, multiple tumors from 1.7 by 20 to 2.6 by 2.6 centimeters, more in the right lobe of the liver, and a 1.4 centimeters obstructing lesion in the pancreatic body with some atrophy. In early 2025, her oncologist mentioned metastasis in the lungs. Chinese medicine considers cancer to be an accumulation of blood clots and phlegm or mucus accumulated into lumps when the body's immunity is lower. The purplish color of the tongue reflects blood stasis. The swollen part on the tongue in this case is metastasized tumors, cancer cells, in the corresponding parts of the body. Case 7. An 80-year-old male with chronic pancreatitis came in for pain management in September 2024. He reported chronic abdominal pain, poor appetite, and tiredness. He mentioned that he was diagnosed with pancreatitis, and conventional treatment has not stopped his constant abdominal pain. He would like to try acupuncture today. His tongue shows multiple fissures that are more concentrated in the middle portion of his tongue. If you look carefully at the left edge of his tongue, there is a strip of mild swelling with a pink-red triangle shape in the middle. This site indicates the current stage of pancreatitis. In Chinese medicine, mild swelling of the tongue indicates damp, extra fluid accumulation in this region of the body, which reflects inflammation. The triangle shape reflects the damaged pancreas. Although the picture cannot provide a precise location of the inflamed pancreas, the pinkish-red color of the lesion on the portion of the tongue reveals a relatively new illness. From the deep fissures on the opposite edge of the tongue, I can logically believe that this patient's liver had some abnormality. However, the patient declined to provide his liver information. Overall, a shining wet surface of the tongue also supports damp accumulation in his system and the principle of Chinese medical theory. Unfortunately, he was not interested in Chinese herbal medicine to reduce his dampness and decrease inflammation for his pain. He also did not think acupuncture helped with his pain, so he stopped treatment. Note: acupuncture may require a series of sessions for chronic or severe pain for successful outcomes.
Hello, I'm Dr. Dong, a practitioner of a Chinese medicine with over 35 years of experience. Throughout my career, I have developed a unique approach to assessing how by closely examine the tongue, a key diagnosis tool in Chinese medicine. When you are curious about your own health status, click the link below and share a photo of your tongue. Let's uncover insight into your wellness together.